Welcome to the deep dive. Today, we're tackling something that, well, pretty much every pet owner, you'll encounter at some point. Nasal discharge in dogs and cats.
Mm,
It might seem like just a sniffle, maybe, but trust us, there's actually a fascinating world of biology and potential health clues packed into that seemingly simple symptom.
that's right. Yeah, we've pulled together a really comprehensive look at this. Our goal today is really to equip you with a much deeper understanding than just, my pet has a runny nose.
Right.
We want to explore the different types of discharge, what they might actually indicate, and why paying attention to this sign is just so important for your animal's well-being.
Okay, so let's dive right in then. When we talk about nasal discharge, it's not just one simple thing, is it? I mean, our sources highlight a whole range of possibilities.
Absolutely not. You might observe a serious discharge first. That's the thin, watery kind, almost like a clear drip.
Yeah.
Often, this can suggest maybe some early mild irritation or perhaps even a viral issue. So while it might seem minor, it's definitely worth noting if it sticks around.
Right.
Then we have a mucoid discharge. This one's thicker, more like mucus.
Ah, okay. Like when you get a cold and your nose starts getting a bit more gloopy.
Exactly, yeah, that sort of thing.
Mm-hmm.
Moving along, we encounter mucopurulent discharge. Now, this is a mix of mucus and pus.
Hmm.
It often appears cloudy, maybe has a yellowish-green tinge. That usually indicates a secondary bacterial infection is kind of getting involved.
I see.
And finally, there's purulent discharge, which is primarily pus, typically quite thick and opaque, again, pointing strongly towards a bacterial infection being present.
And our sources also point out that the story doesn't quite end there, does it? We also need to be aware of when blood enters the picture.
Precisely, yeah. A blood-tinged discharge means you'll see, streaks or maybe a pinkish hue mixed in. This can sometimes happen with just simple irritation, but it's always worth investigating further. Then there's frank blood, or epistaxis. That's a full-on nosebleed.
Right.
And here's something that might surprise you. Nasal discharge can even contain food debris.
Food? Seriously? That sounds really unusual. What kind of, structural issues might lead to that?
Well, this could indicate a problem with the passage between the oral cavity and the nasal cavity. Perhaps a cleft palate or some kind of abnormal connection, and a rhonasal fistula. It's a less common sign for sure, but a significant one.
Wow. Okay.
And while we're on the topic of the nose, it's also worth mentioning xerometeria.
Xerometeria.
Yeah, basically dry nose. You might notice this as a persistently dry, sometimes even cracked appearance on the normally moist surface of your pet's nose, often just on one side.
Ah,
This lack of proper nasal secretion can be a sign of a problem, often linked to facial nerve damage.
okay, so we've got this whole spectrum of wetness, right? From dry to watery, thick, even bloody. What's the fundamental process happening in the body that leads to these different kinds of discharge?
Well, the most common underlying mechanism is an increase in mucus production. You see, the lining of the nasal passages has these cells and glands that are constantly producing secretions to keep things moist and trap debris.
Right, the normal function.
Exactly.
No.
But when something irritates these passages, could be an infectious agent, a physical object like a grass seed, a chemical, or just general inflammation, these mucus-producing elements can really ramp up production.
Ah.
That leads to an increased volume of discharge and changes in its consistency, too.
So it's like the body's trying to flush something out or deal with irritation.
Precisely. Think of it like your eyes watering when dust gets in them. It's that kind of protective response.
Makes sense. So the body's trying to deal with something that's not quite right in the nasal area.
Exactly. And it's really crucial to remember that the nasal passages aren't an isolated system. Our sources highlight how problems in seemingly unrelated areas of the body can actually show up as nasal discharge.
Oh, interesting. Like what?
Well, for example, if an animal is having trouble swallowing, maybe due to a gastrointestinal issue, sometimes those secretions can be forced back up into the nasopharynx and then come out the front as nasal discharge.
That's a connection you might not immediately make. What about when we see blood in the discharge? What's usually behind that?
Blood-tinged discharge, or epistaxis,
Uh-huh.
often points to issues within the blood itself, the lymphatic system, or the immune system.
Okay.
It could suggest a problem with blood clotting, maybe a low platelet count, or even direct damage to those delicate blood vessels lining the nasal passages.
I see.
And interestingly, nasal problems can even be linked to the eyes sometimes. Damage to the nerves in the middle ear, for instance, can occasionally lead to dry eye. Choroconjunctivitis sicca, or KCS, on the same side as the nasal discharge. It's all quite interconnected.
It really is. Okay, here's where it gets really interesting. For pet owners, I think, are some pets more likely to experience these issues than others? Does their age or, their breed play a role?
Absolutely. Age can be a significant factor. In younger animals, for instance, we might see congenital conditions like cleft palates or maybe nasal polyps they were born with.
Right, things they've had from the start.
Exactly. Or conditions like ciliary dyskinesia. That's where the tiny hair-like structures that normally help clear the airways don't function properly. Think of them like little sweeping brushes that aren't working.
Ah, okay.
Or even deficiencies in their immune system, specifically involving certain immunoglobulins like IgA, can show up early in life.
And what about our senior companions? What are they more prone to?
Unfortunately, in older animals, we do see a higher incidence of things like nasal tumors. Also, primary dental disease is a big one.
Dental disease, how does that connect?
Well, a tooth root abscess, for example, can sometimes burrow upwards right into the nasal cavity, causing discharge. That's quite common in older pets.
It makes sense.
Our sources also point to some interesting breed predispositions. For example, if you have a hunting dog that spends a lot of time with its nose to the ground.
Sniffing everything.
Exactly, all that enthusiastic sniffing. They're naturally more prone to getting foreign bodies, like grass seeds, little twigs, stuff like that, lodged in their nasal passages.
Yeah, I can see that.
And then certain breeds with longer noses. The dolichocephalic breeds like collies or greyhounds or dachshunds, maybe they seem to have a higher risk of developing aspergillosis.
That's the fungal infection.
Right, a fungal infection of the nasal passages.
Oh.
And they also seem predisposed to nasal neoplasia, which is tumors.
Okay. So beyond just seeing the discharge itself, what other signs should pet owners maybe be looking out for that might suggest a more significant underlying issue?
Well, the history you can provide to your vet is incredibly valuable. Things like frequent sneezing, for example. Or even reverse sneezing, that snorting, honking sound some dogs make.
Oh, yeah, that startling noise.
That can be strongly associated with nasal problems, particularly if the back of the nasal cavity, the nasopharynx, is involved. It's also really helpful if you can recall when the discharge first started, what it looked like initially.
Like clear versus cloudy?
Exactly. Was it coming from one nostril or both? And importantly, how has it changed over time? Has it gotten thicker, changed color, or is there blood now?
And noisy breathing, that's another important clue, right?
Yes, steromediner, that kind of snorting, rattling, or heavy breathing sound, especially when they're resting or sleeping. That often indicates some kind of obstruction or inflammation somewhere in the upper airways.
Okay.
Also, it's useful to know if your pet has had nasal discharge before, and maybe it cleared up with antibiotics.
Why is that significant?
It often suggests a secondary bacterial infection was present, which the antibiotics treated. However, it's really important to remember that antibiotics typically only address that bacterial overgrowth.
Not the original cause.
Exactly, not the primary underlying problem.
Got it. So when you take your pet to the vet for this, what are they looking for during the physical exam?
Well, a vet will carefully check if there's discharge present, maybe on the muzzle or sometimes on the insides of the front legs, because pets often try to wipe their noses there. They'll also gently assess the airflow coming from each nostril. Reduced airflow can signal a physical blockage like a tumor or maybe a fungal plaque, which can be particularly common in cats with fungal issues. They'll also be looking for any signs that might point to concurrent problems, dental issues, problems in the nasopharynx, or even issues lower down in the airways.
You mentioned bony involvement earlier. That sounds serious. What are some signs a vet might look for there?
Right. This could show up as maybe noticeable swelling or a firm feeling on the face or even on the roof of the mouth. Sometimes there might be pain when the area is gently palpated or touched.
Okay.
These signs could suggest a more aggressive process, like a tumor growing or a severe dental abscess that has actually eroded into the bone.
Oh.
And interestingly, in some dogs with that fungal infection, aspergillosis, you might see a loss of the normal black pigment on the surface of their nose, the nasal planum.
Oh, really? Depigmentation.
Yeah. Enlarged lymph nodes under the jaw could also be a red flag. That might indicate neoplasia, a fungal infection, or even a significant dental infection.
Yeah.
And in some cases, a polyp might actually be visible just by looking in the ear canal during an otoscopic exam, or maybe peeking at the back of the throat.
And you mentioned a couple of other worrying signs before, chorioretinitis and globe deviation. What are those about?
Yeah, chorioretinitis is inflammation in the back of the eye. Sometimes that can be a sign of a systemic infection that also affects the nasal passages, things like canine distemper or a fungal infection called cryptococcosis.
I see.
In globe deviation, that's where the eyeball doesn't look quite right in its socket. It might be pushed aside. That could potentially indicate an abscess behind the eye, a specific fungal infection called synovial aspergillosis, especially in cats, or maybe a tumor that's physically pushing things out of place.
Okay, so we've got a pretty good picture now of what nasal discharge can look like and some of the other clues that might go along with it. Let's really try and get to the core of it. What are the actual underlying causes? How do vets start to categorize these?
Well, we can generally categorize the causes based on whether the discharge is predominantly coming from one nostril, unilateral, or both nostrils bilateral.
Okay, so starting with unilateral, one side.
Right, unilateral discharge often points towards a more localized problem. Common culprits would be things like a foreign body, the grass seed again lodged in just one nasal passage,
Good sense.
or dental disease, where an infection from a tooth root tracks up into just one side of the nasal cavity. Fungal infections often start on one side, a nasal tumor growing in one specific area, or that xeromicteria, the dry nose condition, which is often associated with nerve damage on just one side of the face.
Gotcha. And then when we see discharge coming from both nostrils, that usually suggests something more widespread.
Generally, yes. Bilateral discharge is frequently linked to infectious agents that tend to affect both nasal passages pretty equally.
Like viruses.
Exactly. In cats, common causes are things like feline viral rhinotracheitis, or FVR, and feline calicivirus. In dogs, we might see canine herpes virus or distemper. And very often, secondary bacterial infections complicate these initial viral infections, leading to that bilateral purulent discharge.
Okay.
Other causes of bilateral discharge can include things like IgA deficiency, that's an immune system issue, irritation from airborne substances like smoke or dust, allergies, that ciliary dyskinesia problem we mentioned.
Where the little sweepers don't work.
Right. And general inflammatory conditions affecting both nasal passages, like lymphoplasmacytic rhinitis. Sometimes, structural abnormalities further back in the nasopharynx can also lead to bilateral discharge.
And it's interesting you mentioned some issues that start on one side can eventually affect both.
That's right, yeah. For example, an aspergillus fungal infection or a nasal tumor might begin in just one nasal passage, but can certainly progress over time to involve the other side as well, leading to bilateral signs later on.
I see.
And then there are some causes that can be either unilateral or bilateral right from the outset.
Oh, like what?
Things like a nosebleed, epistaxis, that could be from one or both sides depending on the cause.
Mm.
A foreign body, though usually unilateral, could theoretically affect both sides somehow. Problems originating outside the nose, like chronic pneumonia, or persistent vomiting where secretions back up into the nasal passages.
Right, reflexing up.
Yeah, that could affect both sides. And even certain types of nasal parasites can sometimes cause unilateral or bilateral signs.
Okay, so digging into risk factors then, who is particularly at risk for developing these nasal discharge issues? What are the key things pet owners should maybe be aware of?
Well, there are several factors that can definitely increase a pet's risk. We've already talked quite a bit about dental disease and the possibility of foreign bodies.
Yeah.
Exposure to infectious agents is a big one. So think about animals that spend time in close proximity to others. Kennels, shelters, boarding facilities, dog parks even,
Sure.
or pets that aren't up to date on their vaccinations are certainly at higher risk for those infectious causes.
Makes sense.
Certain breeds, as we mentioned, have that higher predisposition for nasal aspergillosis. Problems with the blood's ability to clot properly are another risk factor.
What causes clotting problems?
That could be due to underlying medical conditions like liver disease, certain immune disorders, or even things like accidental exposure to rodenticides, which interfere with clotting.
Ah, right.
Nasal mites can be a concern, particularly in dogs that have maybe come from or lived in kennel environments. Any condition or medication that suppresses the immune system, like steroid use or chemotherapy, can also make a pet more susceptible to nasal infections. And finally, sometimes seemingly unrelated chronic conditions like long-term low-grade pneumonia, chronic vomiting, or even chronic ear infections that might lead to facial nerve damage can also indirectly contribute to nasal discharge issues.
Wow, it really sounds like a complex puzzle to solve. How does a veterinarian actually go about figuring out the underlying cause? What does that diagnostic journey typically look like?
It definitely can be a puzzle. The first step is often to differentiate true nasal discharge from other conditions that might look similar, especially diseases affecting the areas where skin meets mucous membranes, like around the nostrils. Things like pemphigus, vasculitis, or even leishmaniasis in certain areas.
Okay, rule those out first.
Exactly. Then the characteristics of the nasal discharge itself, what we discussed earlier, can provide really important clues and help narrow down the list of possible causes.
So clear versus mucoid versus bloody.
Right. A thin, clear, serious discharge might suggest mild irritation, maybe viral, maybe parasitic.
Hmm.
A thicker, mucus-like mucoid discharge could point towards allergies, irritants, or even very early-stage neoplasia sometimes.
Hmm.
A cloudy or colored purulent discharge makes you think more strongly about secondary bacterial or fungal infections, or perhaps more advanced neoplasia. And if the discharge is tinged with blood, or is a frank nosebleed, epistaxis, that raises concerns for things like a tumor, aspergillosis, maybe trauma from violent sneezing, or a problem with blood clotting, or even high blood pressure.
So I imagine lab tests must be part of figuring things out too, blood work and such.
Yes, definitely. While routine blood tests like a CBC and chemistry panel plus a urinalysis may not directly pinpoint the primary nasal problem, they're very helpful. They can detect any concurrent health issues, give a baseline, and are really important for assessing a pet's overall health status, especially before any procedures that might require anesthesia.
Good point.
Then more specific lab tests might be needed. Things like serology to look for antibodies against certain fungal or tick-borne rickettsial infections. Coagulation studies are crucial if there's bleeding, to evaluate platelet numbers and clotting times. And sometimes, immunoglobulin quantification might be done to investigate potential IgA deficiencies if chronic infection is suspected.
What about getting a look inside the nose? I mean, that seems like it would be really helpful, but probably quite tricky to do.
Imaging is often a critical component, you're right. Standard x-rays of the skull can sometimes show things like bony changes or fluid buildup in the sinuses, but honestly, they have limitations, especially when it comes to visualizing soft tissues inside the nasal cavity.
So what's better?
Computed tomography, CT scans, are generally much more informative than x-rays for evaluating nasal issues. Both CT and MRI can provide really detailed images of the nasal passages. They help determine the extent of any bony destruction or if there's any involvement of the central nervous system, which is super important if you're worried about nasal tumors, fungal rhinitis extending, or complications from chronic ear infections reaching the brain.
Okay, CT is often the way to go there.
Often, yes. And sometimes chest x-rays might also be recommended, especially if there's a history of chronic coughing, or to look for subtle signs that might suggest ciliary dyskinesia affects the lungs too.
And then there are even more direct ways to look inside the nasal passages, right? Like with cameras.
Absolutely. For cases where the main sign is a nosebleed, measuring blood pressure and checking those platelet counts and coagulation profiles are really important first steps.
Makes sense.
Then, rhinoscopy that's using a small camera, often a flexible endoscope to actually visualize the inside of the nasal passages, is frequently indicated.
What kind of cases?
Usually for pets with chronic or recurring nasal discharge, or maybe acute severe nosebleeds, where you need to find the source. You can look from the front, that's anterior rhinoscopy, and sometimes from the back via the throat, posterior rhinoscopy.
Okay. And what about samples?
Samples are key. Nasal cytology, where you collect cells perhaps with a flush or a swab and look at them under a microscope, can sometimes reveal general inflammation or maybe certain types of cells like fungal organisms, but it's often not specific enough to give you the exact underlying cause.
Right.
Fungal and bacterial cultures can be performed on discharge or, ideally, tissue samples obtained during rhinoscopy. But interpreting these results can be tricky because the nose normally has bacteria and sometimes fungi living there. So just growing something doesn't always mean it's the cause of the problem.
Ah, so it could just be contamination or normal flora.
Exactly, which is why.
Biopsy.
Yes, in many cases, a nasal biopsy is necessary to get a definitive diagnosis. Taking multiple tissue samples from different areas within the nasal passages during rhinoscopy is really crucial to get an accurate picture of what's going on.
Okay.
And if ciliary dyskinesia is suspected, those biopsy samples might need special processing to be examined under an electron microscope to look at the structure and function of the actual cilia.
Wow, that's specialized.
It is. And if there's a concurrent cough, a bronchoscopy putting a camera down into the airways might be warranted to evaluate the lower respiratory system too. It's also vital not to overlook dental health.
Back to the teeth again.
Yep. Periodontal probing, where the vet measures the depth of the gum pockets around the teeth,
Mm.
is often part of the workup because, as we said, dental problems can easily extend up into the nasal cavity.
Right.
And in cases where facial nerve damage is suspected, maybe causing that dry nose or even some facial asymmetry, a Schirmer tear test to measure tear production, a thorough ear exam, otoscopy, or even a CT scan might be helpful in finding the cause, like middle ear disease. And finally, just to be complete, for confirming ciliary dyskinesia definitively, really specialized tests like tracheal scintigraphy or transmission electron microscopy are sometimes needed, but those are usually done at referral centers.
That is a really thorough, multifaceted approach to diagnosis. Okay, so once a diagnosis is finally reached, what are the typical treatment options? What happens next?
Well, treatment is going to be highly specific to the underlying cause that's been identified, naturally. But there are some general supportive measures that are often recommended, especially for pets being treated at home as outpatients.
Like what?
Things like ensuring they're well hydrated, making sure they're eating adequately. Sometimes you need appetite stimulants, especially for cats who lose their sense of smell. Keeping them in a warm, comfortable environment. Gently cleaning away any discharge to keep their nostrils clear.
So they can breathe easier.
Exactly. And in some cases, using local therapies like saline nasal drops or even nebulization with saline can help soothe the nasal passages and thin out thick mucus.
Okay. And sometimes they need to be hospitalized.
Yes, for more intensive treatments. For instance, if surgery is needed, like removing a tumor or extensive dental work, or for applying certain topical medications, like the treatment for nasal aspergillosis, often requires anesthesia and careful flushing, so that usually means inpatient care.
Right. And what about specific medications then?
Again, it completely depends on the diagnosis. If a secondary bacterial infection is present or suspected, antibiotics are often prescribed, usually something with a good spectrum against common respiratory bacteria.
Makes sense.
Decongestants and topical nasal vasoconstrictors, things that shrink the nasal lining temporarily, might be used very short-term to help relieve severe congestion. But these need to be used really cautiously.
Why cautiously?
Well, they don't fix the underlying problem. They can sometimes damage the nasal lining with prolonged use, and you can get a rebound effect where the congestion actually gets worse when you stop them. So, very limited use, if at all.
Okay. Good to know. What else?
For cases of rhinitis clearly linked to dental disease, you need antibiotics and usually dental surgery to address the infected tooth or teeth. That's key.
Just the source.
Exactly. If a foreign body is found, it needs to be physically removed, often via rhinoscopy, and antibiotics might be given afterwards. For pets with nasal parasites, there are specific antiparasitic medications like ivermectin or milbemycin or fenbendazole, depending on the parasite.
Okay.
In cases of nonspecific inflammation where maybe a biopsy just shows inflammation but no clear cause, sometimes corticosteroids like prednisolone or other anti-inflammatory drugs like piroxicam might be tried to reduce the inflammation and signs.
And for the fungal infections?
Right. For nasal aspergillosis, topical antifungal medications like clotrimazole or inoconazole infused directly into the nasal passages under anesthesia are often the first line. For other types of fungal infections, or if aspergillus spreads, systemic antifungal medications taken by mouth, like etraconazole or fluconazole, might be necessary.
In cancer.
Neoplasia, or cancer, is typically treated with a combination approach. That might include radiotherapy, chemotherapy, sometimes surgery, depending on the tumor type and stage.
Okay.
And for that specific issue of xeromicteria, the dry nose, sometimes an oral medication called pilocarpine can be tried to stimulate the production of nasal secretions, but its effectiveness can vary.
Are there any medications you mentioned that need extra caution or maybe shouldn't be used in certain pets?
Yes, definitely. It's always important to be aware of potential contraindications and precautions. For example, ephedrine, which is sometimes found in decongestants, should generally be avoided in patients with pre-existing heart conditions.
Right.
Ivermectin, a common antiparasitic, needs to be used very cautiously, often at lower doses in collie breeds and related herding dogs, due to a potential genetic sensitivity, the MDR1 mutation, which can lead to serious neurological side effects.
Okay. Important for those breeds.
Very. Certain antifungal medications like itraconazole can have potential side effects we need to watch for loss of appetite, nausea, vomiting, sometimes elevated liver enzymes. So monitoring with blood tests is often needed during treatment.
Right.
And as we mentioned earlier, that prolonged or excessive use of topical nasal vasoconstrictors can cause rebound congestion, making things worse in the long run.
So getting the right treatment started is crucial, but it sounds like follow-up and ongoing monitoring are also really important. What does that typically involve?
Close patient monitoring is absolutely key. Owners need to be really vigilant in observing any changes, improvement, or worsening in the frequency, amount, and characteristics of their pet's nasal discharge, and any associated signs like sneezing or breathing effort.
Keeping a close eye.
Exactly. In cases of fungal rhinitis, especially aspergillosis, repeat rhinoscopy might be necessary after treatment to visually re-examine the nasal passages, assess how well the treatment worked, and see if the infection is resolving or if more treatment is needed. And for pets with chronic pneumonia that might be contributing to nasal discharge, repeat chest x-rays or even another bronchoscopy might be needed down the line to monitor their response to therapy.
And finally, what are some of the potential complications that can arise, either from the nasal discharge issues themselves or maybe even from the treatment?
Yeah, several complications are possible, unfortunately. Loss of appetite is a common one, particularly in cats, as nasal congestion heavily impacts their sense of smell, which drives their appetite.
Ah, right. If they can't smell, they won't eat.
Exactly. The primary underlying disease itself, whether it's a persistent infection or a tumor, obviously has the potential to spread or worsen. It could extend into the mouth, the eye socket, or in some more serious cases, even extend towards the brain.
Scary.
Significant nasal obstruction, if it gets bad enough, can lead to difficulty breathing and even genuine respiratory distress, which is an emergency. And specifically with treating nasal aspergillosis, there's a small risk because the fungus can sometimes erode the thin bone called the cribriform plate that separates the nasal cavity from the brain.
Oh, wow.
Yeah. So when applying topical antifungal drugs, it has to be done very carefully to avoid inadvertently forcing medication through that barrier, which could potentially cause central nervous system damage. It's a known, though thankfully uncommon risk.
Wow. Okay. This really underscores that what might seem like just, a simple runny nose can actually be a sign of something much more complex going on underneath.
Absolutely. It really highlights why paying attention is important. Having a better understanding of the different types of nasal discharge, the huge variety of underlying causes, and the other associated signs can really empower pet owners and, frankly, help veterinarians arrive at an accurate diagnosis more efficiently and implement the most effective treatment plan.
Yeah. So the clear message here, I think, is that if you notice persistent or, concerning nasal discharge in your dog or cat, maybe it changes color, lasts a long time, has blood, or comes with other signs, it's definitely not something to just ignore and hope it goes away on its own.
Please don't know.
It can be a symptom of a really wide range of issues, some of which, as we've heard, can be quite serious if they're left untreated.
Exactly right. And it really drives home how interconnected all the systems in the body are, doesn't it? A seemingly localized issue like nasal discharge can have surprisingly far-reaching implications for a pet's overall health and well-being.
It really does.
So we'd strongly encourage you, the listener, to just be observant of your pets. You know them best. And please seek veterinary advice if you have any concerns at all about nasal issues that aren't resolving quickly or seem unusual for your pet. It's always better to err on the side of caution when it comes to their health.